What is monkeypox?
Monkeypox is a rare smallpox-like disease that occurs primarily in the rainforest countries of Central and West Africa. The disease was discovered in laboratory monkeys in 1958. Studies of animals in Africa later found evidence of Monkeypox virus infection in a number of African rodents. The virus has been isolated from an African tree squirrel, which may be the natural host. Laboratory studies showed that monkeypox also could infect mice, rats, and rabbits. In 1970, monkeypox was reported in humans for the first time. In June 2003, monkeypox was reported in prairie dogs and humans in the United States.
What is the cause of monkeypox?
Monkeypox is caused by monkeypox virus, which belongs to the Monkeypox virus group of viruses. Other members of this group of viruses that cause infections in humans include variola, smallpox, vaccinia, used for smallpox vaccine, and cowpox viruses.
Outbreaks.
Human monkeypox was first identified in humans in 1970 in the Democratic Republic of the Congo, then known as Zaire, in a 9-year-old boy in a region where smallpox had been eliminated in 1968. Since then, most cases have been reported from rural, rainforest regions of the Congo Basin, particularly in the Democratic Republic of the Congo, where it is considered to be endemic. Since 1970, human cases of monkeypox have been reported from 11 African countries: Benin, Cameroon, the Central African Republic, the Democratic Republic of the Congo, Gabon, Ivory Coast, Liberia, Nigeria, the Republic of the Congo, Sierra Leone, and South Sudan. In 2017, Nigeria experienced the largest documented outbreak, 40 years after the last confirmed case. The true burden of monkeypox is not known. For example, in 1996 to 97, a major monkeypox outbreak was suspected in the Democratic Republic of Congo with, however, a lower case fatality and a higher attack rate than usual. Some patient samples tested positive for varicella virus and some contained both varicella and monkeypox viruses. Concurrent outbreaks of chickenpox and monkeypox could explain a change in transmission dynamics in this case. The virus has been exported from Africa a few times. In the spring of 2003, monkeypox cases were confirmed in the United States of America. Most patients were reported to have had close contact with pet prairie dogs that were infected by African rodents that had been imported into the country from Ghana. Recently, monkeypox was carried to Israel in September 2018, to the United Kingdom in September 2018 and December 2019, and to Singapore in May 2019 by travelers from Nigeria who fell ill with monkeypox after arrival. A health worker was infected and became ill. Two distinct genetic clades of the virus have been identified, the Congo Basin and the West African clades, with the former found to be more virulent and transmissible. The geographical division between the two clades is thought to be in Cameroon, as this is the only country where both monkeypox virus clades were detected.
Transmission.
Infection of index cases results from direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. In Africa, evidence of monkeypox virus infection has been found in many animals including rope squirrels, tree squirrels, Gambian poached rats, dormice, different species of monkeys and others. The natural reservoir of monkeypox has not yet been identified, though rodents are the most likely. Eating inadequately cooked meat and other animal products of infected animals is a possible risk factor. Secondary or human-to-human transmission is relatively limited. Infection can result from close contact with respiratory secretions, skin lesions of an infected person, or recently contaminated objects. Transmission via droplet respiratory particles usually requires prolonged face-to-face contact, which puts health workers and household members of active cases at greater risk. The longest documented chain of transmission in a community was 6 successive person-to-person infections. Transmission can also occur via the placenta from mother to fetus, congenital monkeypox.
Signs and symptoms.
In humans, monkeypox is similar to smallpox, except that enlargement of lymph nodes, or lymphadenopathy, is associated with monkeypox. About 12 days after exposure, the illness begins with fever, headache, muscle aches, backache, swollen lymph nodes, a general feeling of discomfort, and exhaustion. Within 1 to 3 days, sometimes longer, after the appearance of fever, the patient develops a papular rash, i.e., raised bumps, often first on the face but sometimes initially on other parts of the body. The lesions usually develop through several stages before crusting and falling off.
Is there a treatment for monkeypox?
Currently, no treatment is available for monkeypox. Smallpox vaccine has been reported to reduce the risk of monkeypox among previously vaccinated persons in Africa. CDC is assessing the potential role of post-exposure use of smallpox vaccine as well as therapeutic use of the antiviral drug CD4.
Which nation's health agency has confirmed a case of monkeypox recently?
UK Health Security Agency confirmed that an individual has been diagnosed with monkeypox in England. The patient has a recent travel history from Nigeria, where the virus is believed to have been contracted. Monkeypox is a rare viral infection that does not spread easily between individuals. The infected individual is being treated at an expert disease unit in London.
The end.
Please subscribe to our channel to watch the latest content. Let's squeeze!